Here, looking into the centre of the knee, the probe is being used to examine the torn ligament. It should be attached to the femur seen on the left of the image, but has pulled away and has now stuck down on the PCL. The first part of the operation is to remove the old ligament and create space for the new graft. After the old ligament has been removed, the back of the knee is examined to identify the attachment point for the new graft. A pilot hole is made using an awl. This is then increased in size using drills of a specific diameter. Here is the finished socket into which the ACL will insert. A similar technique is used on the tibia, with the guide wire coming out at the base of the old ligament. Again, this is increased in diameter to match the size of the new graft. A stitch is retrieved to connect the femoral and tibial tunnels together. This is then used to pull the sutures and ultimately the ACL into the knee. It is then advanced into the socket of the femur. In this case, hamstring tendons were used to create the ACL. Here you can see the reconstructed ACL crossing the knee and attached to the femur. And the difference is clear when compared to the start of the operation. A final check to see that the knee moves freely before the end of surgery.